Today, we are also honored to be joined by Dr. Omar Farouk, an Associate Chief Medical Officer at Penn State Health. If anyone is qualified to speak on COVID-19 and global pandemics, it's him. So Dr. Farouk, welcome to our IPAC webinar. Let's get started with our Q&A session. Jenna, the floor is yours.
Hi, Dr. Farouk. Thank
Hi.
you so much for joining us. If you recall, back in March, Texas Governor Greg Abbott issued an executive order lifting the mask mandate in Texas and increasing the capacity of all businesses and facilities in the state to 100%. Texas's lifting of the mask mandate has caused Americans to wonder when their states will take a similar action, and when can we expect to not wear masks and social distance?
Thank you, Shahan, for the kind introduction, and thank you, Jenna, for the wonderful question. So really, I think you're right that this order started a downstream, really opening of this concept that when can the states be open? What are the benchmarks? So I went back actually and looked at the order myself, and at that time, this was March, I think they were still very careful, and they looked at some of the criteria. One was that they looked at two areas. One is the low hospitalization area, and the other when they have an area where the hospitals are full or they are on higher capacity, like more than 15%. So you're right. So people or population living in the area with low hospitalization rate, they opened the businesses. And if the patients or people were living in the area with high hospitalization rate, I think they suggested or recommended to wear the masks, not necessarily mandating it. So if I give you the example of Pennsylvania, where I currently live and practice medicine, so the governor said that once the 70% of the state population of people above age 18 will be fully vaccinated, I think they will lift the masking mandate. Right now, you know where we are? 54.6. Nationally, it's 52%. We are at 54.6. So Pennsylvania is ninth in the rank as how many constituents and citizens have been vaccinated. So we are hoping that by the end of this month, which this is currently June 2021, maybe once we hit this benchmark of 70% vaccination, we will open the state similar to what happened in the Texas.
This spring, schools have been going back in person, and at times following all the CDC guidelines is difficult. Should young people still be worried about catching COVID? What precautions should we continue to take as schools reopen completely in the fall?
Yeah, thank you, Shaza. I think this is a great question, and I'm a parent. We had, like other parents, very like a year full of uncertainties, anxieties. Before, like a couple of months ago, even kids were not getting vaccine. Right now, as you know, the children age 12 and above, they are eligible to get the vaccine. So there has been a great uptick into getting children 12 and under being vaccinated. 60.3% of the population of children age 12 and 18 have been vaccinated. 50 like first dose, and I have 49%, more than 12 are fully vaccinated. So which is, I think, a huge shift. So, but for schools, it was a very tough, decision. As you know, the school year is just ended. Yesterday was the last day of the school for my son. He's in 7th grade, so he will go to 8th grade. So during the 7th grade, they had to follow the same guidelines. So for schools, there are children who are younger than 12 who will, I don't know when the vaccination will be approved for those children. But there are 5 key principles for the school reopening in the middle of the pandemic right now. So the first is really the correct use of masks. So for schools, as of this fiscal year, which has just ended, I think the masking was recommended, and correct use, which means it should fit properly. Physical distance was the second, and there was a study done when they compared the physical distance between 3 feet and 6 feet, and 3 feet was as effective as 6 feet. So some of the guidelines from CDC, like if in the elementary school, keep them 3 feet apart. If middle and high school, 6 feet. If there is high community transmission, the orange and the red zone, but if the community transmission is still low, 3 feet apart. The other concept at school, the important thing about the physical distance was that it was noted that transmission is high between adults to students. So I think there is still, even if students among themselves are 3 feet apart, but the recommendation is that between students and other adults like staff members and teachers, it should be 6 feet. So how do you feel about it? You have to stay away from your teacher 6 feet, but among your own group, you can be 3 feet apart. The other cool concepts are cohorting. So maybe if there are 20 students in a class, make like 4 cohorts of 5 students. They always are kind of maintain a cohort and keep less of the distance, and then keep the one cohort this 6 feet away from the other cohort. The other things like face the desk in the same direction. So this also minimizes the spread. And if there are some activities which involves high vocals, singing, breathing, exercises, try to do those activities outside. So we talked about masking. We talked about physical distance. The other thing is hand washing and your respiratory etiquette, the coughing etiquette, which need to continue, cleaning and contact tracing. So those are the 5 tenets, what you continue to need at schools to prevent any transmission in that workspace.
Thank you, Dr. Farouk. As a student myself, I know how hard it is to follow COVID guidelines, especially when I'm with all my friends. As a result, I completely sympathize with those making a decision between imperative subjects like education and COVID safety. Moving on, though the vaccine was reapproved on April 23rd, on Tuesday, April the 13th, the CDC and FDA, in a joint public statement, recommended the pause of the use of the Johnson & Johnson vaccine after 6 reported cases of a rare type of blood clot. Consequently, a plethora of misinformation regarding the safety of vaccines has emerged. Is the Johnson & Johnson vaccination safe? Are the COVID-19 vaccinations safe?
Thank you, Shahan. I think when we saw those cases after J&J vaccine, there was even temporary pause, because the healthcare authorities really wanted to dig deep into it and find as what's the root cause, if there is an association, and what to do to move forward. As you know that the morbidity and mortality associated with COVID itself is very high. So vaccines, they provide protection. So this is the interesting fact they found. All 6 patients or 6 people who had the side effects, those were women younger than age 50 with low platelet counts. So this triggered some sort of an immune response in their body, and first the vaccine was paused, and then they resumed as the benefit really outweighs the risk. However, there is a recommendation that women younger than 50, there are other vaccine candidates available. They can get Moderna, they can get Pfizer. So it was suggested that they go that route. As far as the safety of the other 2, Pfizer and Moderna vaccines, hundreds of millions of doses have been given in the country. I remember presenting a study which was published in JAMA when I think they presented their data of 11 million and 14 million patients, and the rates of severe anaphylactic shock or adverse effects was maybe 1 and 2 in 100,000 patients. So, and this actually was similar or better than the original study. So far, overall, the vaccines are safer and effective. And when you compare with the morbidity and mortality of COVID, there is no second question asked.
Thank you. Adding on, a lot of Americans have been hesitant to receive the vaccine due to its side effects. So what are the potential side effects of the Moderna and Pfizer vaccines? And does that mean the person who received that vaccine has COVID?
So, Serene, thank you. I think this is one of the most commonly asked question. I'm not sure if any of you received the vaccine. Did you experience any side effects? Can you explain?
I personally, when I got the Pfizer vaccine, I got my second dose and I felt very sick for a day or two. Besides that, there wasn't too much, but I've heard, at least my doctor, when he gave it to me, said there were a lot of people having very bad reactions. So I was a little confused, or we were just wondering, like, are there side effects beyond just the simple, like, slight sickness?
Anybody else wants to share their experience?
I got my first dose last week, and the only side effects I had was soreness in my arm, but I'm expecting in my second dose I'm going to have a more severe reaction, but I didn't have anything bad at all.
Okay. Anybody else wants to chime in?
I also got my first last week, and I had, soreness, and then I also had like a stomach ache, but it was nothing major too.
So I have exactly same experience as Andrea got. So when I got Pfizer myself. So the first dose, I was very happy. I didn't get any side effects besides the mild soreness that was there for maybe 3-4 hours. But you know what? After second dose, not only that, I got the soreness in my muscles. There was mild redness, some swelling in this whole region. But then next morning, 24 hours later, with maybe 18 hours later, I felt if I have no strength in my body. My muscles felt like jelly. I couldn't move them. Tiredness, achiness, some of the joints hurt, and then symptoms really lasted for 24 more hours. And I took some Tylenol and I was okay. So 2 kinds of side effects to be aware of. One is local pain, swelling, redness. The other is more systemic in the body. Tiredness, headaches, those muscle pains, aches. Some patients get diarrhea, some gets headaches. Excuse me. So I have served as the vaccine. We have like many of the states, you probably have seen those large mega community vaccination sites. So I've served as the physician of the day. So some patients who are very, vaccinated create some anxiety, there's big lines. So I've seen some patients, maybe 1 or 2 every few days out of 800 patients or 900 patients we vaccinate every day, is like they faint. So it's not uncommon. So especially if somebody was not very hydrated, one patient who was diabetic, he didn't eat anything, he took his medicine, didn't eat much, didn't drink much, came to us after the work. So he was about to faint. So we had him kind of lay down and give him some blood pressure checks and ask him to drink something, and it quickly resolved. And that's where, if you see that, they say observe the patient for 15 minutes, right? Somebody asks you to sit down for 15 minutes. So that was the reason that we do that if there are any immediate side effects, especially the vasovagal or the fainting or pre-fainting. The severe one is anaphylactic shock or anaphylaxis. So that is like proper allergic reaction. And that has been seen in the rare instances. And that's where most of the vaccination sites, they are equipped to have the epinephrine pen. So if somebody gets a reaction, they can give it to that quickly. But overall, the vaccines are considered very safe.
Thank you, Dr. Farouk. As all this vaccine drama unfolds, people are wondering how the world is going to change a little bit. As everyone knows, since the world has started to open back up, there's been the infamous 2-week quarantine as recommended by the CDC, where if you come into contact with someone who has COVID, you are recommended, or you should quarantine for 2 whole weeks to make sure you can't spread it to anyone else. Well, in your opinion, once herd immunity is established in America, do you think that this quarantine will be reduced and or eliminated?
Yeah, so I think Dr. Fauci, he mentioned that the 70 to 85% of the population needs to be vaccinated to achieve that, the herd immunity status, as you just mentioned. Interestingly, I presented that state of Pennsylvania, suggested that once the vaccination rates are at 70%, we will go with unmasking and opening up everything. And then, so this is the interesting thing is, people now, according to CDC updated guidelines, if somebody is fully vaccinated, they do not need to quarantine. They do not need to be restricted from work or even need to be tested, even when they are exposed to somebody with suspected or positive COVID, because the risk of infection and spread, is kind of lower than previously we thought. But if somebody, has been exposed, they should monitor themselves for the next 14 days, but they do not need to stay home. There are some exceptions as well. So the fully vaccination residents and employees of the correctional facilities, detention facilities, and homeless shelters, you have to follow those quarantine and isolation guidelines. But if somebody is fully vaccinated, CDC has recently changed its guidelines and recommendation. Let me screen share so can I ask the our host to allow me to share the screen? Yes. So let's look at this document closely. Can you all see my screen?
Yeah.
So there are activities outdoor and indoor. On the right hand side, fully vaccinated people, and you see that the fully vaccinated people without the mask and with the mask, right? Everything is in the safest. Whereas on the left, on your other hand side, the unvaccinated people, so there are 3 categories: either they're safest without mask, with mask, and then less safe and more safe. So if you go to the outdoor activity, it's interesting that outdoor walk, bike, when you are with your own household members, is very safe. When you attend an outdoor gathering with other fully vaccinated family and friends, so somebody who is unvaccinated, actually I'm vaccinated, so somebody who is unvaccinated and they go to completely vaccinated people, I think that is safe and it's outdoor. Now, third is that if there is a small outdoor gathering when there is mixture of vaccinated and unvaccinated people, so you see that if somebody is vaccinated, it's safe without the mask. But if you're not vaccinated and you don't know the status of other people and it's outdoor, wear a mask. Now, you are dining at the outdoor restaurant, okay? And then there are multiple households. Now you go in the yellow zone. But then if you go into a crowded outdoor event, like a live performance, parade, or sports event, that's when the vaccinated people should wear the mask, keep them, because I think sometimes it's so overcrowded that you cannot maintain the distance. Whereas it's very unsafe for unvaccinated people. Now, going to the indoor activity, you can see that if somebody is not vaccinated, all indoor activities are in the yellow zone. So this is kind of less safe for them, whether they go to a barber, whether they go to a crowded indoor shopping mall, whether they take a bus or a train, whether they attend a small indoor gathering with fully vaccinated and unvaccinated people. But you know what? The activities which are extremely unsafe for them, they go to an indoor movie theater. You can imagine, like, it's going to be a crowded place. They attend a full capacity worship service. They are signing in as indoor, chorus. They are in an indoor restaurant or the bar, and they are doing some sort of a high intensity class inside a gym, like a yoga class, or some of the other intensity class. So that's very least safe for them if they are unvaccinated. So they should wear the mask. So the bottom line is that if you are vaccinated, and once hopefully we reach to that 70% vaccination, the CDC will remove some of the masks, even on the fully vaccinated people as well, on this infographic. So this I just use this as a guide to understand as of June 4th, this is where we stand. As we progress, as we get more and more people vaccinated, just imagine, let me ask you, so when schools open again, what time your school open? August or September? August. So you have several more months. This is what I have seen trends wise. When we had the mass vaccination open, so there was like initial, everybody wants to get it like maybe yesterday, not today, yesterday. Then more and more people like eager who wanted to get the vaccine, they got the vaccine. Then once you hit that 50% of the population vaccinated, then there are some people in the community, because the first 25 to 30% early adapters quickly get the vaccine. Then you come in the middle, like this wait and see group, so who had some questions, queries, and I think they watch some of your webinars and some of the activities that you try to do, and they see what's happening in the news media, experience from the other patients, so they have received vaccines. Then the vaccination trend had declined, so we had more open slots available at the vaccination sites than the actual demand or actual people who wanted to get the vaccine. Once the Pfizer approved once the FDA approved the use of Pfizer, actually authorized the emergency use authorization. I just need to use all the words carefully. We are seeing like another increase demand for the vaccination in younger population. Now, that the first question when CDC first question about this the change in the state of Texas, and when CDC recently said, okay, fully vaccinated people can resume those activities without masking. And by the way, those recommendations, they do not apply to healthcare settings. So they do in certain areas, they apply to out of healthcare. So with this new recommendation, I think there was another incentive for people to get vaccinated. So we are seeing again, more people wanted to get the vaccine. Historically, I think there are some healthcare system in the country who ask their employees to be fully vaccinated. So not everybody is doing, but there are some. So you will see the change. I think the bottom line is, by the time school opens, the hope is that more and more people with the are vaccinated, and especially our adolescent population between the age the 12 and 16 and 16 and 18, everybody's vaccinated. So most of them are vaccinated. So you don't have to be very, very restrictive. So by the way, next year CDC hasn't released guidelines for the next year yet. So they're waiting probably to see where the numbers are. Who's next?
Oh, thank you, Doctor. So many Americans have been using the excuse of immunity or antibodies to engage in reckless social behavior that puts others at risk of infection. So what do you have to say to these people, and how long do antibodies really last after getting COVID?
So Jenna, your question is really that if somebody who actually got the COVID-19 and now they have developed some immunity in their system. How long this immunity lasts. So there are two kinds of immunity. One is the immunity from the disease or from the virus itself. So COVID, disease, and then immunity. The other is immunity from the vaccine. What we have seen is the immunity from the viral infection itself is not durable. It's not long lasting. 6 to 8 months have been kind of quoted in different studies. So after that, patients can get COVID second time. I know someone personally very, very well who got COVID twice. First last year, and the second episode 13 months after the first episode, a few months ago. And this time she had heavier symptoms, more symptom burden, more pain, more shortness of breath, and then this delayed, lingering kind of recovery. So when somebody gets infection for the first time, 6 to 8 months after the first infection, the antibody level actually goes down. The immunity or the protection from the virus in the body goes down. So they are at risk of second infection. The immunity from the vaccine is proven to be more durable and sustainable. The question is, how long? We don't know. Okay, who's next?
Thank you, Dr. Farouk. So with the rollout of vaccinations to millions of Americans, many people are wondering whether specific COVID guidelines still apply to them. So should people who are vaccinated wear masks in public?
I think we kind of discussed this question. Right now, fully vaccinated people, when they are in the outdoor, the CDC has, as I showed you, the guidelines. So unmasking will be based upon once the 70% of the population in different states, and different states are at different stages of this, the implementation. So let's see, but hopefully, down the road, you may not have to wear masks.
Thank you, Dr. Farouk. Another question that's emerged this year focuses on gatherings in vaccinated individuals. To what extent is it safe to meet with other vaccinated people? Is it okay to host large gatherings with vaccinated individuals?
Yeah, so I think the CDC has, some guidelines on that as well, that if the entire group is vaccinated, they can gather. I think that if you have large groups, and then everybody's vaccinated, it's great, but then try to keep it. Maybe it's better that if you do it outdoors, not indoors, or the area where there is, decent ventilation. And still, I believe in safety first, and prevention is better than cure. I foresee that, and I have several patients of mine too, that once everybody's not wearing the mask, but that because of certain conditions, you are at high risk. What would you like to do? Now, this is a patient's perspective. Most of my immunocompromised patients said no. They said, we love this mask. Not only that it protected us from COVID, but we did not get any influenza this year. We did not get any common cold this year. We actually, we are so used to, and we feel that this helps us and protects. So this is a patient's perspective. I just want to be clear on that. So let's see. I think there will be more changes. I think that what COVID has taught us, that in life, agility and is important, and being responsive to what the data is out there, and changing your kind of position based upon the ground reality. So things will continue to change and improve.
Dr. Farouk, as everything unfolds, especially with the Johnson & Johnson vaccine causing a little bit of a scare, is there ever a situation where it is not safe for someone to get this vaccine in particular?
Yeah, so I think the biggest safety issue was this severe allergic reaction, which you call anaphylaxis. So if somebody who already had anaphylaxis from the previous dose, they are more likely to get this with the follow-up dose as well. So those are the people who, you have to be very, very careful and don't do it. And it's not that the mRNA is giving you this allergy. It's really the one of the component of the whatever the vaccine, the actual, the immunogenic material, it's in that liquid. So liquid is PEG or polyethylene glycol. So that, although is considered very inert, and it's used in a lot of different medicine and other substances which you eat. So if somebody who has known allergy to polyethylene glycol, those are the one who are at risk of. So really the contraindication is severe allergic reaction, or somebody with immediate reaction of any severity to the previous dose, based on any compound inside the vaccine. Other than that, if somebody is immunocompromised, those patients were included in the original trial, and then the vaccine was effective. Older age, patients from different ethnic backgrounds. So the original trials were very all-inclusive. They tried to get the best representation from the population, including the healthy and sick people, and vaccine worked in all or most of them.
Thank you, Dr. Farouk. Considering the risk for those with allergies, as you mentioned, I think you would agree with this, that it's imperative that these people with allergic tendencies consult their doctors prior to receiving the vaccine. Transitioning to our last question, as of May 1st, 41.6% of the country's population was vaccinated. Nevertheless, with such a number, many Americans are wondering how long the effectiveness of the vaccines lasts. Will we have to get vaccinated yearly?
Yeah, so thank you. I think when you're right, you gave the updated number. So at least, the good news is back in April, the 19.9% of the country's population was fully vaccinated. As of today or now, it's like this number is above 41%, which is, I think, a huge change. But if you take another slice, more than 18 years, there's 52% of the population so more than half of the people who are above age 18, they are fully vaccinated. More than 12 years, I told you, 49%. And anybody above the age 65, there's 75% of those people are already fully vaccinated. So when we will have 70 or 80%, I don't know, but I think we are going towards that. The second question or component was about the boosters. Boosters, I don't think we know the answer if we would need booster at a year time or a 2 years time or a 5 years time, or maybe never. If you look at some of the vaccines, I remember, for example, hepatitis B, you get first, second, and third dose like in the first 6 months, and then there's a recommendation for booster at 5 years, either based upon the antibody testing or not. So I don't know the answer that if we would need boosters, but there has been a lot of talk that what if you need like a booster every year? So time will tell. I don't have the answer to this question.
We would once again like to thank Dr. Farouk for spending his time with us answering some of our questions. There was a lot of confusion surrounding the new normal that we find ourselves in today, especially with all the misinformation circling around the internet and especially social media. I hope that everyone here has learned something valuable that can help us all stay safe as we navigate these uncertain times. Once again, thank you, Dr. Farouk, for coming out here today.
Thank you, all of you, and it's my pleasure, and I'm happy that I'm able to talk to this wonderful group of young people. Hopefully, your colleagues, your cohorts, your peers, they will get some benefit and more knowledge and information from this. So keep smiling, stay happy, stay healthy. Have a good rest of the day.
Thank you.
Thank you.